Hi, my name is Kayla. I'm going to be your nurse today. Can you tell me your name and your date of birth, please?
Yep, Brittany Blanchett, 7/14/93.
Perfect. And what brings you here today, Brittany?
Just a well visit.
Okay. So your patient is oriented. She is conversing with me appropriately. And are you having any pain today?
Nope.
No. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever had?
0.
0. Perfect. Okay, so we're just going to do a head to toe. We're going to start on your scalp, work our way literally down to your toes. Let me know if you have any pain or discomfort as we go, okay?
Okay.
We're going to start with your pupils, so if you can just look straight ahead. Pupils are about a 7 on my pen light, round and equal. And now we're just going to test their response to light. Perfect. So the pupils constrict in response to light. Great. So your pupils are perla. They're equal, round, reactive to light, and accommodating. And now I'm going to just have you follow my pen, testing your cardinal fields of gaze. And just don't move your head, look straight ahead, but follow the pen with your eyes, okay? Looking for any abnormal movements, any smooth shaking. Perfect. No nystagmus noted. Then I'm just going to have you follow the pen in towards your nose. Great. And your eyes accommodate appropriately to that as well. And lastly, I'm just going to check your corneal light reflex so you can continue to just stare straight ahead. And the light is reflected equally off of the eyes, so that's perfect. Now I'm going to start with your head, feeling your scalp, assessing. Doesn't appear to be any lesions. Is there any tenderness?
Nope.
Nope. Assessing your ears as well. Any pain or tenderness here?
Nope.
Any problems with hearing?
Nope.
Nope. I'm going to have you just open your mouth, stick your tongue out, and say, ah. Perfect. So mucous membranes are pink, hard and soft palate are visualized and intact. I'm going to assess your lymph nodes now, so if I can have you turn this way, starting with your occipital, postauricular, preauricular, parotid, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And was there any pain or tenderness as I was doing those?
Nope.
Great, they felt good. No tenderness or matted nodes. Next, we are going to, I'm going to have you shrug your shoulders. Perfect. So cranial nerve number 11, spinal accessory is intact. Working my way down your arms. Can you feel this all the way?
Yep.
Any pain or discomfort?
No.
Nope. Checking capillary refill. Great. Less than 3 seconds on both hands. We're just going to assess your radial pulses while I'm here. And perfect. Those are strong and equal bilaterally. Now if I can have you grab my fingers and squeeze. Great. And pull me towards you. And push me away. Perfect. So muscle strength is intact. All the cranial nerves are intact as well. Now I'm going to start with a cardiovascular assessment, starting with your carotid pulses. And those are strong and equal. Now I'm going to listen to those carotids. If when I place my stethoscope, you can just hold your breath for a second. Hold it. Great. Let it out. And just hold it again. Perfect. So there's no turbulent blood flow, no swishing that would indicate a bruit. Next, I'm going to move on to your cardiac valves. Starting with your aortic valve, second intercostal space, right sternal border, S2 greater than S1. Moving on to your pulmonic valve, second intercostal space, left sternal border, S2 greater than S1. Moving on to Erb's point, third intercostal space, left sternal border, S1 and S2 are equal. Moving on to the tricuspid valve, fourth intercostal space, left sternal border, S1 greater than S2. And the mitral valve, fifth intercostal space, midclavicular line, S1 greater than S2. While I'm here, I'm just going to listen to the apex of your heart. Great, then I'm going to palpate the carotid, checking for a pulse deficit. And good. The pulses were equal, so you have strong perfusion. Just going to palpate your apical pulse while I'm here, assessing for any thrills or vibrations. And good, that feels normal. And I'm going to listen one more time with my bell of my stethoscope. aortic, pulmonic, herbs, tricuspid, and mitral. Great, that sounds good. Now we're going to move on to respiratory. So I'm going to listen to your 6 fields on your front, 2 on the sides, and 8 on the back. So starting with your bronchial, expiration greater than inspiration, moving on to bronchiovesicular, expiration and inspiration equal, and vesicular, inspiration greater than expiration. If I can have you just turn towards me, deep breath. Perfect, now the other way. Great, and then towards the other wall. Bronchiovesicular, S1 and S2 equal, and vesicular. Inspiration greater than expiration on those. Okay, turning back towards the front. Oh, I'm sorry. Have you go back. Just going to assess for respiratory expansion. If you can take a deep breath. Great. And just for CVA tenderness as well. Any pain or tenderness when I do that? No. No. Okay, perfect. You can turn back to the front. And I can have you sit. Okay, I'm going to start with your abdomen. Do you have any problems with urination or moving your bowels?
Nope.
Okay. Just going to start by listening in all 4 quadrants for bowel sounds. And that's great. Bowel sounds active in all 4 quadrants. Now I'm just going to listen with my bell of my stethoscope to your abdominal arteries, listening for any bruits or turbulent blood flow. Starting with your aortic artery, renal, iliac, and your femoral. Good?
Good.
Sounds great. And now I'm just going to palpate. Let me know if there's any pain or tenderness.
Nope.
Nope. Good. So abdomen is flat. Patient has no evidence of ascites or bulging lesions. Now I'm just going to work my way down your legs. And can you feel me all the way down?
Yep.
All right. Any pain or tenderness?
Nope.
Checking your capillary refill. It's great. Less than 3 seconds on each toe. Now I'm just going to assess your dorsalis pedis pulse. And that is strong and equal. Moving on to your posterior tibial. Also strong and equal. If you can give me a push here, that's great. And now pull up. Perfect. So that looks good on your feet. If I can have you sit forward now, I'm just going to test your patellar reflex. Okay, perfect. Alrighty, so that looks good. Is there anything else I can do for you today? Any questions you have?
Nope, that's all.
Thank you.